So let's talk about some common treatments of some of the conditions we've discussed as they relate to cardiovascular disease. We're going to be covering some surgical treatments as well as some non-surgical treatment possibilities. And let's begin with a non-surgical treatment that is used to treat blockages in arteries, particularly coronary arteries. And this is something called percutaneous coronary intervention, most commonly known as angioplasty and stenting. This is a non-surgical procedure. Essentially, what this procedure aims to do is to open up a blocked heart artery. So if you have a coronary artery that is filled with plaque due to atherosclerosis, this is a treatment that can be used in order to expand that artery, to reduce the narrowing of that artery by essentially expanding it from the inside. And so the way that this is done is through a catheter, something called a cardiac catheter. Cardiac catheter is essentially a long, narrow tube that is inserted, usually starting from the groin, into a blood vessel. And it has a little camera at the end, and it's guided through the body and directed to the blocked heart artery. And once it reaches the blocked heart artery, then a balloon is fed through the catheter, and then it's inflated at the site of the blockage in order to open up that artery. When the balloon opens up and it's inflated, it expands a wire mesh called a stent. And then the balloon is deflated, removed from the blood vessel by removing the catheter with the balloon, but the mesh remains in place. The wire mesh remains, and it essentially keeps the blocked artery open more efficiently. So that was a non-surgical approach to coronary heart disease. So let's talk about a more invasive approach, which is surgery, and in particular what we call coronary artery bypass surgery. Coronary artery bypass surgery is a surgery that is performed to reduce the risk of death due to coronary heart disease when you have a very seriously blocked coronary artery. If angioplasty and stenting is not possible, then for some patients, the only approach to reducing the blockage is not so much reducing the blockage, but actually bypassing it with a graft of a blood vessel from elsewhere in the body, which is then attached around the blocked vessel so that it can essentially form a detour around it. And so if you cannot open up the blockage, then you can then bypass the blockage. Think about it this way. If you think about the blockage as a traffic jam, you need to go from point A to point B, and you need to go through this particular road in order to get from point A to point B. But there's a traffic jam because there was an accident. Angioplasty and stenting would be about widening that area where the traffic jam is by sort of, removing the blockage. So maybe sending a few tow trucks in to remove the cars that are in the way, and then allowing the rest of the cars, the blood flow to pass. Coronary bypass surgery would occur when it is not possible to remove that blockage or to expand it. And so it would be more like an accident that is really severe and there's just no getting around it. And it is really blocking that movement from point A to point B. So what can you do? Take a detour, go around through another road. And that is essentially what coronary artery bypass surgery does, is provides blood that detour. It provides blood that alternate way to get from point A to point B being the actual heart muscle. And so here you can see the process of coronary artery bypass surgery. This is open heart surgery, so they have to start by moving blood out of the heart so that the heart can be repaired, and then the graft is added. This is, dangerous surgery. This is open heart surgery. It requires the heart being stopped in order for the coronary graft to be inserted. And sometimes people will have more than one graft inserted, so they might do like a double or a triple or even a quadruple bypass surgery, which means that this is the number of areas that are going to need to be detoured. So now let's talk about surgery that would treat aneurysm. And so there are two common treatments options for brain aneurysm. The first one includes surgery, and the second one is a non-surgical approach. So surgical approach is called surgical clipping, and it is a dangerous surgery. It is basically open brain surgery. Part of the skull is removed in order to access the brain and access the area of the brain where the artery, where the aneurysm is. And then once the neurosurgeon can access the aneurysm directly, it basically can close it off by placing a tiny metal clip that is placed at the neck of the balloon of the aneurysm, and that deflates the balloon and it stops blood from flowing into it. So this is a dangerous procedure because it requires a neurosurgeon to get right into the brain. There's always the risk of the aneurysm bursting during the procedure. However, it is the most effective approach to preventing an aneurysm from bursting at some point. And essentially, an aneurysm is sometimes like a ticking time bomb where it's fine, the balloon is there filled with blood, and it's not life-threatening until it bursts. But it can burst at any time, depending on the weakness of the blood vessels. So surgical clipping might be a good alternative if the patient is a good candidate for neurosurgery and the aneurysm itself is in a location that is easily accessible to the neurosurgeon. But sometimes surgery is impossible, and the surgery itself might pose more danger to the patient than the aneurysm itself. So then a second approach, which is non-surgical, is something called an endovascular coiling. And so during endovascular coiling, just like with angioplasty and stenting, a catheter is inserted through the groin and it's fed through an artery all the way to the side of the aneurysm in the brain. And then a wire mesh is deployed in order to strengthen the section of artery. And also a wire coil is released and placed within the balloon itself. And what the coil will do is it will disrupt the blood flow into the aneurysm, but it also will induce clotting. This is something called embolization. Now, embolism is a clot. So it's going to induce clotting within the aneurysm, and that will essentially prevent blood from entering into that balloon and therefore disrupting the aneurysm itself. Endovascular coiling is a much safer approach than surgical clipping, but it is not as effective as surgical clipping. So, they have their pros and their cons. So, for a lot of the times, though, a major part of treating cardiovascular disease is actually prevention, reducing atherosclerosis via lifestyle changes. Like, for example, quitting smoking, eating better, exercising, but also it might involve using medicines that can help reduce some of the other risk factors that you might have. So, for example, it might include cholesterol medication that could reduce LDL cholesterol. Taking aspirin. Some people take actually a daily aspirin, usually baby aspirin, like low-dose aspirin, because aspirin is actually a blood thinner. So that can prevent blood clotting. It could include, if you have diabetes, include managing your diabetes properly, and that can include medication. If you have hypertension, high blood pressure, it could include medication that is going to reduce your blood pressure and your hypertension. So essentially, managing the risk factors that can reduce a person's chance of developing atherosclerosis, reducing the chances of blood clotting are basically some of the most effective methods of dealing with cardiovascular disease. Prevention is key. If risk factors are present, reducing the risk factors and therefore preventing the formation of life-threatening plaques and blood clots that can then lead to strokes and heart attacks. So that's it for today's lesson. Have a great day. Goodbye.